I think that Lucian never dreamed when he published his paper, Error in Medicine, in the mid-90s, that it would lead to the kind of movement that we now have in patient safety.
In the late 1980s, after a long and distinguished career as a pediatric surgeon and a professor of surgery, Dr. Lucian Leape shifted his research interests to medical error. His 1994 paper, Error in Medicine, is largely recognized as the catalyst for the modern patient safety movement. As a member of the Institute of Medicine's Committee on the Quality of Care in America, he contributed to the groundbreaking reports To Err is Human, Building a Safer Health System, and Crossing the Quality Chasm.
He had the groundbreaking paper that really began to expose the epidemiology of harm that exists in hospitals.
Lucian Leape is a pathfinder because of his stature in the medical profession. When he began focusing on the issues of patient safety, he basically created the field. He legitimized the open questioning of why it is we're not producing perfect patient safety.
Some of his original work really was foundational for bringing a focus to patient safety, and especially in thinking about systems as opposed to people to try to improve patient safety and thinking about a culture of safety.
Lucian put patient safety on the radar screen. I can remember very vividly as a medical resident sitting in a hall at Mass General Hospital hearing about the Harvard malpractice study for the first time from Lucian. It changed my life. Lucian started it all.
Well, I think first and foremost, he's raised awareness that frankly never existed before. I think he's shown us and helped us imagine what could be possible to create true safety for patients.
Dr. Leape was one of the founders of the National Patient Safety Foundation, which was announced at the Annenberg Conference on Medical Error in 1996. In 1997, NPSF became an independent, not-for-profit organization.
On the 10-year anniversary of NPSF, we decided that we were going to honor the person who had made the most difference in the field, and that was Lucian. And that was when we formed the Lucian Leape Institute at NPSF. And he loves his industry and the professionals who serve in it, and his profession and patient care unconditionally.
In 2009, the Lucian Leape Institute published its first paper, Transforming Healthcare, a Safety Imperative, which outlined fundamental concepts to bring about meaningful improvement in healthcare safety.
I think the real key influence that Lucian had is that he brought to global awareness and really changed our consciousness about what was possible in healthcare to build a safer, more respectful, more professional environment.
I think all of us in the Lucian Leape Institute feel we're making progress, and we have a long ways to go, but we're on the move.
Dr. Leape's research, insight, focus, and leadership have changed the field of medicine forever.
When I think of Lucian's contribution to patient safety, I think of his stature. I think that having a physician of his stature and reputation and integrity embrace patient safety as a core value, influence the entire healthcare system.
I love Lucian Leape because of his unbridled passion and commitment to patient safety. He's been an inspiration to me for many, many years, and I also love working with him because he never hesitates to focus on how important it is to treat everyone with respect and dignity.
It's important to have individuals that we look up to, and we all look up to Lucian in his outstanding leadership in the field.
The bottom line of Lucian's career is that he's changed the world. He started the patient safety movement, he nurtured it, he pushed us hard, he called the tough questions, but all the time he was there to nurture us. He kept us going after he started us, and he'll keep us going for a long time to come.
For the many lives he touched as a surgeon, for the thousands who have benefited from his advocacy of safety, for his inspiration and guidance. we offer our sincere gratitude.